Okay. So, good evening, friends. I am Dr. Harivansh Chopra, and I am once again with you.
I am Dr. Harivansh Chopra and I am once again with you.
Okay.
I am Dr.
So, I hope my screen is visible. Yes. So, good evening, friends. I am Dr. Harivansh Chopra, and I am back with you once again. And the today's topic is stress and how to manage stress by non-pharmacological means. As we have discussed three lectures on the reversal and prevention of coronary artery disease and diabetes mellitus, which were taken very well by all of you, and where we talked about the all the various factors, and one missing link was there, that was stress. And I said that whenever the opportunity will be there, we'll be taking this lecture on stress. And stress, of course, is a very common phenomena in today's arena, because the pandemic is going on, and everybody says that one he or she is under tremendous stress. Well, what is stress? First of all, we'll have to understand. Nowadays, we say the stress is quantifiable. Anything which increases your heart rate and blood pressure is designated as a stressful event. And one has to understand that before we go into the detail of the management, one again, just a brief recap of the various system which exist inside our body. There are two system in our body, what is known as a sympathetic system and a parasympathetic system. And whenever we are under stress, then our sympathetic system is stimulated, and which ultimately give rise to rise in blood pressure and heart rate. Of course, there are various mechanisms by which we can stimulate the parasympathetic system, and these mechanisms are very well known. And these mechanisms, they include your deep breathing exercises, yoga, and meditation, which increases the tone of the parasympathetic system. And once the tone of the parasympathetic system increases, then the tone of sympathetic system goes down. So that way, as far as the markers of the stress are concerned, they can be brought under control. But when we say non-pharmacological, then we have to understand what is stress and how we can manage stress. Is it only the deep breathing exercises, yoga or meditation by which we can control stress, or there are something more beyond this? And that is why I thought it will be a good lecture, because it's a innovative lecture. And the I always say the stress is not a disease or a condition. Stress is an acronym. I say stress is an acronym, and why I say stress is an acronym, I will be talking about it. And it will be a very small presentation today. With the help of 7 8 slides, we'll be talking about it and how we can do it. You can consider it to be a lifetime experience, which we are going to put in today's lecture, that one, how one has to live, and irrespective of circumstances, one should remain happy. That is the philosophy. If you want to remain stress free, I always say, and I quote, this is given by me only, that life is full of choices. I quote, life is full of choices. It is up to one to remain happy or otherwise. So, and happiness, real happiness is that in which one can remain happy irrespective of circumstances. What the yogis in our countries have said, that if you can reach to a state of neutrality, meaning by nothing should give you pain, nothing should give you enjoyment, right? If you can go to that stage, of course, that is the ultimate stage which one try to strive to achieve, but then it is not easy. You have to do a lot of practice. The other thing to remember in is this, that in life, in our life, 90% of times we react, only 10% time we take action. So if we are reacting to situations, then these situations are going to result in some or other degree of stress. And that stress is to be minimized by understanding this acronym. So with this overview, we'll be moving forward, and let us see what is the uh, full meaning of this word stress. So there are six words, six letters, you can say: STRESS, right? So what is the first S? The first S is, why it is not moving? Okay, first S is for strength, and we'll be talking about which kind of strength we are talking, and that will be very, very interesting and important. Then T is for traffic control. T is for traffic control. Majority of time we develop stress when there is a traffic jam inside our brain or inside our cerebral cortex. Then R is for redesign. R is for redesign, and what we have to redesign, we'll be discussing that in maybe in the next 3 4 slides. Then E is for erase. That is very, very important. You see, eraser is something which is required whenever we teach or we preach. Without eraser, we cannot teach or preach, because if you write something wrong, then you have to erase it and correct it. So erase word you'll have to remember is a most important word if you want to remain stress free. Then is another word, another S is for share. Sharing is caring, and there are a lot of things which are to be shared as and when you acquire newer things: wisdom, knowledge, strength, money, and so on. You must start sharing, because sharing will give you a lot of mental satisfaction and peace, and which can help you to remain stress free. And last but not the least, whatsoever religion you may believe, or whatsoever your religious thinking are there, so you can always uh, have belief in that. And if you don't believe, then you can always believe in a supernatural power, and you can surrender to that power. I called it God. And God is all pervading. It is present everywhere. And when we'll be talking more, we'll be talking about it. We'll be talking about it. We'll be talking more about it as and when we move forward. So that is the acronym. Now, I hope it should be clear to you. When we call stress, the answer of stress is already there in the stress. Answer of stress is there in the stress word itself. That is strength, traffic control, redesign, erase, share, and last but not the least, surrender to God. And if you look carefully at this slide, what has happened? We kept the word stress here now in the box, and once we have opened it up, we have explained you with the help of all the terms. Then what has happened? The stress is gone. So let us take it one by one. Let's come to the first S, that is strength. When we talk of strength, then one must understand that, yes, what kind of strength is required? Physical strength. Yes, of course, physical strength is something which, again, this COVID has also proven that, yes, if you are not indulging in physical exercise, and you are not maintaining your BMI as per your age and sex, then you are in a big, big trouble, because you may be landing up into metabolic syndrome, and those, then you will be getting a lot of diseases, which we have already discussed in the previous three presentations. So I will not be going into the physical. And the other advantage of making physical fitness is that, yes, physical fitness is again directly related to your exercise status. Of course, it is related to your nutritional status also, but it is also related to exercise status. And exercise to a certain extent also help in alleviation of stress. Then comes your emotional and intellectual. Now, before we go to the emotional strength, because you see, we have seen people, something goes wrong and the tears are there in their eyes and they get stressed, they get stressed, something goes wrong. Ultimately, what is exactly stress is, what are your expectations and what is the reality? The difference between these two can give rise to stress. So you will have to understand that you will have to perform your duties, and outcome is, again, you see, if you are attached to the outcome, then you are bound to have some degree of stress. Some people say some kind of stress is also required if you want to move forward in life. No, as far as my opinion is concerned, it need not to be the stress. You should be stimulated enough, and we can talk about it. The theory of karma and inspiration, that will be a different aspect altogether. Maybe some other time we'll be going to talk about more. The most important, I think, in this is another S, that is the spiritual aspect. And again, I'll give a quote here, and I quote, spirituality starts, I quote, spirituality starts where science ends. Meaning by that, spirituality and science, they are interrelated. And if you have read, or if you are a medical personnel, then you must be knowing that our body, human body, is the best optical illusion, because our body is made up of various tissues and organs, and these tissues and organs are made up of cells. So basic unit of human body is a cell, and cell ultimately thrive only on energy, right? So what cell needs? Cell needs ATP, and this is produced by the mitochondria, right? Cell cannot survive without energy, and that is why we always talk of nutrition, because nutrition is required to provide energy to the cell. And if we talk of energy, then energy neither can be created nor can be destroyed. Point number one. Point number two, that if we all are made up of energy, then there is no difference between you and me. There is no difference between the individual. It is only the optical illusion which differentiate between the people, right? So if you have that much of spiritual knowledge in your mind, then whatsoever is happening will not affect you. That will not affect you. You will not be becoming emotional. It's a COVID time, and a lot of people are suffering from, of course, suffering always give rise to some kind of emotional outburst, as well as the intellectual outburst also. We always discuss and talk how this pandemic is being managed and what is happening and what is not happening. But then one, if one is having a spiritual strength, then one must understand that life and death are the two absolute truth. Rest is only a process. All of us have to undergo that process, and we have to be intelligent enough to understand the purpose of our life, and we should be intelligent enough to save ourselves so that we are able to fulfill the purpose of our life. Again, that purpose of life is again related to your spiritual strength. So that is why when we talk of health nowadays, we always say the fourth dimension is very, very important. That is the spiritual dimension is very important. And as far as suffering and healing is concerned, beyond doubt, it has been proven, and Dr. Rahul has already taken a very beautiful lecture on a mind body connection and mind body healing. So one has to understand that whatsoever thinking is going on inside your body, that thinking is not there inside your body, that thinking is going on inside your brain. So you'll have to control the thought processes in your brain, and that gives us some idea why stress happens, because that then from S we go to T, and that is the traffic control. Why you get stressed? Because you keep on having the similar kind of thoughts in your mind over a period of time. So it is just like a situation that you are traveling in a car and there is a traffic jam, and there are number of cars ahead of you and there are number of cars behind you, and you are stuck up in a traffic jam and you can't come out. So you have to control the thought process in your mind. Always you will have to control. You react. I told you that 90% time human being are, you can say, brought up in such a manner that 90% times we react to the stimuli, we react to people's action. We should not. That is the moot point. We have to have that intellectual and spiritual strength to understand that everything is not in our hand. We have to do our job, and if something is not going on as per our expectations, then we should not be stressed. We have to control our thought process is to be kept under control. You see, you must understand this. And as a professional, as a doctor, if you are a doctor and listening to this presentation, it is very, very important, because we have to face a lot of situations where despite our best of effort we are not able to save the patient. And COVID has been the perfect example, where a lot of you might have seen people dying in ICUs if you are doing duties there. So you might have seen that, and you might have seen a lot of suffering. But then you must understand it is our duty, and we have to keep on performing our duty. We cannot have control over the outcome of each and everyone's life. You have to understand this, and you have to practice this, because you see, medical professional, they are always under stress. And this word has become a slang in the medical language. Okay, oh, there is a great degree of stress, because the moment you enter into medical college, then you are under stress because of the studies. Then there is a first terminal, then there is a, after 4 months there is a second terminal, then third terminal, then professional, then terminal, then professional, then terminal, then professional, and you keep on giving your exam. But then you must understand, once you become a doctor, once you become a specialist, or you become a super specialist, then every patient is your examination. You have to treat, you have to provide treatment, cure, palliative treatment. But then more important than that is you have to provide counseling. And that counseling, lack of counseling, has caused a lot of stress in this COVID pandemic. We have forgotten this art of counseling because of the COVID does not allow us, does not give us time to counsel the patients. And of course, that will be another lecture. We'll be talking more about it, the home treatment of COVID, sooner or later. Then we'll talk more about the impact of counseling as far as the outcome of COVID patients are concerned. Because the thought process, again, in the mind of the patient is also important. It is not the thought process in the mind of the caregiver, it is the thought process in the mind of the care seeker is also important. And if he or she is reassured of the outcome, then the outcome is bound to be better. That is one thing which is missing. So that we'll have to understand. You have to understand the thought processes which are going on inside your brain, as well as you will have to understand the thought processes which are going on in the mind of the patients to whom you are going to provide the services. So traffic control is very, very important. You may be perturbed due to the events happening during your duty times, or maybe at home, or maybe at workplace, right? But then you have to develop the habit. You have to develop the habit of letting it go, because I'll be more talking more when I come to the next slide. So you must understand, and that is why we say, whenever you are stuck up in the thought processes, then try to change your environment, listen to music, dance, talk to your friends. These are the ways by which you can change the thought processes which are going on. And COVID time, of course, it is difficult, but yes, that is why you see the social distancing word was there, the physical distancing was there, and then we said it should not be the social distance, it should be a physical distance. Socially, we should be interacting with each other. Physically, we may stay apart, maybe 6 feet, 2 meters or more, but then the social distancing should not be there. So that is why the term was later on changed to distance, physical distance. And that is the whole point, that you have to understand what is going on in and around your brain as well as in and around the brain of the people with whom you are interacting. And you have to develop the art of listening. And I often jokingly say that why the God has given us 2 ears. Yes, why the God has given us 2 ears. The God has given us 2 ears just to listen from one and let it go from the other one. You just grasp what is important and rest things, let it go. That is again important, and that we'll be covering more when we go to the maybe go to the next one. Then the next word is R is for redesigning. There is a lot of stress. Of course, in COVID era, people say they are overworked. They are working so much. They are working so much. They don't have time, and of course, they have to be staying away from the family. So what is required here? You see, if a doctor is always overworked, if you ask me, my experiences say I can tell you that till the age of 45 years or so, I never slept for more than 4 hours in a day because the workload is always there. If you are working, and if you must understand, if you are working, work will be more. If you are not working, then work will be less. So you'll have to take a call on your work, whether you can redesign your work or not. And when we say redesign, you have to redesign your work as well as your time schedule, and you might have to take the help of others in redesigning that. If the same schedule is giving you lot of stress, then then you will have to then you will have to then you will have to redesign your work in a manner that you start loving your work. Work never gives you stress. You must understand, if you love what you do, it will never give you stress. That should be the motto in life. Whatever you are doing, if you are loving that, then you will be excelling in it. If you are studying and you are loving studying, why the study will give you stress? Similarly, if you are treating patients, then if you are loving it, if you are providing relief to the patients, why it will give you stress? It should not give you stress. Similarly, if you are working in the field and you are enjoying your work in the field, why it will give you stress? So whatever you do it, that it is your responsibility, it is your duty, and you must learn to enjoy your work. If you can do that, then probably the question of getting the stress will not be there. Yes, time management is again very very important, and majority of time we are not able to manage our time, and that is why we get stressed. And I always say, whenever there is a question of a discipline, I always say that okay, this time which is made, this is made by the man. Basically, this watch is made by the man. I always say that if somebody is asking you to come in time and go in time, you can always keep your watch 15 minutes ahead. So you will always be reaching at your duty on time because your watch is 15 minutes ahead. So, and that way you can always manage your time. Time is again important. Time management is again very, very important. And you don't have to waste your time. Try to utilize your time as much as possible. And when we say time, it is important not only to work, it is important to understand how to relax while working. And that is why in today's era, in COVID era, a lot of people say that people are bound to screen and they are working tirelessly. And of course, you might have seen the videos of the so many doctors and paramedical workers, even in pp kit, they are dancing to the music whenever they are able to get time, because whether they are enjoying the recovery of a patient or they are removing their own stress in this manner. So you'll have to understand, it is not only work. It has to be work with relaxation. And if you are able to do that, so that is what is the meaning of redesign. You have to redesign all the things. And if you are able to do that, so take home messages here are two, that if you do what you love, your work is not going to give you stress. The second thing is time. Yes, time management is important, but then one must learn to relax also while one is working, because doctors majority of time they do not know how to relax in between, and that is where the role of the music therapy and other things comes into picture. That is the place where the role of hobbies come into the picture. So you have to understand that simply work is not going to help you. You must learn to relax, you must learn to enjoy, and you must be able to spend some quality time. Of course, in COVID era it is difficult, but this COVID era will not be there forever. So you must learn to uh, spend quality time with your family and friends, and you must be able to manage your time. It's not that you will be working 24 hours. We have seen it, and the burnout syndrome and untimely deaths of so many doctors, they occur because they are not able to manage the time properly. So you will have to understand, you have to put a full stop on your activities at one point of time, or right. So you have to have some time for yourself, for your friends, for your families. So that COVID has taught us, there is no better teacher than COVID. The COVID was the best teacher in 2020, and 2021 COVID is the again is the best teacher. So you have to keep on changing your schedules so that you don't go into burnout stage. Then from R we go to STRE. Now let us go to E. E is very important. E is for erase. I said in the beginning also, without eraser, you cannot teach or preach anything. And what are the things which you must be able to erase in your personality? This is the again this is a lifestyle story. You must understand, and there are four things which I have written. If you see it carefully, what you should be able to erase: your ego. That is the, you see, the majority of the time the interpersonal relationships, whenever they give stress because of the interplay of ego. When everybody start believing that he or she is correct, and then there is a ego clash. So you have to learn the art. And again there is a quotation which I say, I quote: let us learn to disagree. Right, let us learn to disagree on certain points and move forward. Let us learn to disagree. Right, disagreement is again important. We should agree to disagree and then move forward. We should agree to disagree and then move forward. Right, so you have to understand what are we are nothing basically. That I have already explained you when I was talking about the spirituality part. We are all bundles of energies. So it's a optical illusion. If you have read Deepak Chopra or his writings, who is again a famous doctor, and he has done a lot of work on spirituality and mythology. So if you read him, he always says human body is the best optical illusion. And even if in psychiatry, if you read what is id, ego, then you will understand we identify our body as we, but we are not our body. We are all thought processes. So our if our thought process is good, and if you go to the teaching of Buddha again, what Buddha says, what you think you become, basically. So we are only thought processes, and if a thought processes are poor, and then we are able to understand the viewpoint of others, and we are able to accept the viewpoint of others, and if we are able to erase the ego part, then we'll be moving forward. And you must understand, this is at times it is better to lose a battle to win the war. At times it is important to give give away, because you must understand, if you keep on fighting on certain points on which you don't agree, you are harming your body, you are increasing your heart rate and blood pressure. Nothing is going to happen. And and the second thing is anger. Again, anger is very important. What is anger? You get angry because somebody has committed some mistake. So others mistake, because of the others mistake, you are getting angry. So there is no justification, and that is why again I go back and I always say that 90% time we react to situations. So you have to erase anger. You don't have to get angry. Maybe it should be a control. Even if at times you have to show your anger, depending upon the administrative stage in which you are there. So, but then it should be a controlled anger. And I hope you understand the meaning of anger. And I can tell you a little story here, that how you can control your anger. And that is a story. It will be in bilingual. I'll be talking more about here about 2 minutes for Buddha. बुद्धा, गौतम बुद्धा का नाम आप सबने सुना होगा. You must have heard the name of गौतम बुद्धा. एक बारी गौतम बुद्धा अपने शिष्यों के साथ एक पेड़ के नीचे बैठे हुए मनन कर रहे थे एक गांव के अंदर, और उस गांव में से एक आदमी उनके पास आया, और उस आदमी ने आकर गौतम बुद्धा के मुंह के ऊपर थूक दिया और बहुत कुछ उनको बोला, और उसके बाद उसने उनके मुंह के ऊपर स्पिट किया, थूक दिया. गुस्से वाली बात है. गौतम बुद्धा के जितने वहां पर अनुयायी थे उनको बहुत गुस्सा आया, और वो उठे और उसको मारने के लिए उठे. तो गौतम बुद्धा ने उन सबको रोका, उनको बोला नहीं, उसको कुछ मत कहो, उसको जाने दो. वो आदमी चला गया. गौतम बुद्धा थोड़ी देर तक शांत रहे, और उसके बाद उन्होंने अपने अनुयायियों से बोला कि उस व्यक्ति को बुला कर लाओ. तो जब उनके अनुयायी उसको बुलाने गए, तो उसने सोचा कि अब तो मैं उसको भी ग्लानि हुई कि मैंने ये गलत काम तो कर दिया, लेकिन अब वो डर भी गया बेचारा कि अब तो मैं गया, मेरी तो अब खैर नहीं है. खैर वो धीरे धीरे चल के गौतम बुद्धा के पास आया. तो गौतम बुद्धा ने उसको अपने पास बिठाया और उसको बोला कि मैंने आपको इसलिए बुलाया है कि मैं आपको धन्यवाद देना चाहता हूँ. ये सुनकर तो वो आदमी और उसके गौतम बुद्धा के अनुयायी सब आश्चर्यचकित रह गए कि ये क्या बात कर रहे हैं बुद्धा जी, कि इसने तो इतना बड़ा पाप किया है कि इनके मुंह के ऊपर थूका है, और वो कह रहे हैं कि मैं उसको धन्यवाद देना चाहता हूँ. तो गौतम बुद्धा ने यही कहा कि हाँ, मैं आपको धन्यवाद देना चाहता हूँ. ऐसा नहीं कि मुझे गुस्सा नहीं आया, मुझे गुस्सा आया, लेकिन मैं आपको धन्यवाद इसलिए देना चाहता हूँ कि आपने मुझे मेरी सहनशीलता की सीमा को और ज़्यादा बढ़ा दिया. I hope you got my point. When somebody is trying to defy you, or somebody is trying to uh, make you angry, then you should be thankful to that person. Don't get angry, because he is enhancing your tolerance. That is the message which this story tell you. So anger should not be there, and at times when if you have to show, then it should be a drama of anger, nothing else, nothing more. One should not remain angry, because if you remain angry again, what will happen? It will increase your heart rate, and it will increase your blood pressure, and you will be suffering. That person will not be suffering. So we always say you have to have a wall between yourself, your brain, and other people, and you should be ready to accept or reject whatever you want to. And that is what I said in the beginning, that you have got 2 years, hear from one and let it go from the other one. They are two years are this, because the God has given you. Then fear is again very, very important. Majority of time in our life we are afraid what will happen, whether it is your exam, whether it is your competition, whether it is your patient, right, whether it is your future. You are always, we are taught, we are brought up in such manner that fear is a integral part of our lives. And we are living in such an arena now, modern arena. We should not be having any fear of anything. If we understand, if you are spiritually strong, we must understand that yes, this is all a process, and all these processes will keep on happening. Time is not going to wait for anybody, right? So there should not be fear. If there is a fear, what is the ultimate fear? The biggest fear is the mortal fear. If you ask me, the biggest fear is mortal fear. That is that one day everyone is going to die. But that is the truth. You must understand, whosoever has taken birth is bound to die. Rest is in between. Between life and death is the process of life. So the fear should not be there. And in modern times, if you talk of Western psychology in modern times, now we are living in an era where you want to secure your future, you want to secure the future of your family, you want to secure the future of your nears and dears, right? So there are enough mechanism nowadays available in the society, and I always talk to my postgraduates, even my students also. I ask, even in the first class, in my first lecture, whenever I take, I ask this question: how many of you are medically insured? That is one insurance which everybody must have. And once you start earning, the other kind of insurance is known as the term insurance, term life insurance. One must take it. That will take care of your family. So these are the two mechanisms which are there, and this should be good enough to remove all the fears from your mind, right? Fear give rise to so many reactions and so many stresses in the mind. And again, you must understand, and I'm telling you again, we'll be talking more in detail sometime when we'll be talking about the treatment of COVID, home treatment of COVID versus hospitalized treatment of COVID. You will understand that majority of time the outcome is not favorable in the hospital. Why everybody says, if he has gone to the hospital, if the patient is on ventilator or on BiPAP, there are less number of chances that he'll come back, because the reassurance, the counseling part is not there. The fear is there in the mind of the patient. The fear is too great. The fear for survival is too great, right? So there are a number of stories we can share later on, maybe when we'll be talking more. So that you'll have to erase. One should not be afraid of anything, but that does not mean that if there is a fire going on and then you jump into it, you should remain guarded. You have to guard yourself. It does not mean erasing of fear does not mean that you start taking unnecessary risk. That you'll have to understand. Then next is jealousy. Yes, jealousy arises when there is a comparison, and the whole word can be defined in one word, and that word is comparison. But one must not compare. Everybody, every one of us is unique in one or the other dimension of life. So why should we compare ourselves? And if we don't compare, then there is no question of having any jealousy with anybody. The moment we try to compare, then the feeling of jealousy comes in. So right, so these are the four important things which you'll have to erase from your mind. The erasing is very, very important. Forget and forgive and move forward. If you follow this principle, it your life will be always enjoyable. I am telling you with my experience that if you if you if you follow this principle of forget and forgive, don't remember bad things in your life. Remember only the good things. Don't remember the bad attributes of anybody. Remember only the good attributes, right? So that way it will make your life more enjoyable and it will be more stress free. So these are the four things which you'll have to understand. You'll have to understand and you have to follow. And that is why I said I kept the topic as non-pharmacological treatment. I'm not talking about any yoga, meditation, or exercises. I'm trying to explain you the meaning of the word stress and the answer which is there in the word stress is. So we have come down to erase. So we have to erase these four things, that is ego, anger, fear, and jealousy. Think about it. You can do an introspection. You can listen to this lecture again and again, and you will find it, and you will be surprised to see what you are doing, what you have been doing. And if you are able to remove all this, I think you will be the most happy person in this world. Then comes your next comes your S, sharing. Again, that is very important. You must understand in life, you must understand. If I ask you a question, to whom you say is a good person? For me, a good person is the person uh, who is doing something good for me or for the society. That is a good person. A good person is one who always help others. Is that right definition of a good person or not? So how can you do that? You can only do that when you are in a giving mode. When we say sharing, it means giving. You have to give. And when we say you have to share, so what you have to share? First of all, you must share your knowledge. That is what I'm trying to do for last so many months together, and I'll keep on doing it. That whatever knowledge I have acquired, I was not born with that knowledge. I have acquired it. I have taken it from my teachers. I have taken it from my patients. I have taken it from my students. I have taken it from my colleagues. Whatever knowledge I have acquired, I'm trying to give it back to more people, so that ultimately we reach to a stage where everybody becomes knowledgeable, so that this world becomes a better place for living. Number two, you have to share your experiences. You must understand, you can read lot of books, but it is said, again there's a quotation, it is said, you may read for 100 hours, but if you spend 1 hour with your professor, right, you will gain more. You will gain more knowledge, because you will be uh, getting the experience of the professor. So that is the value of experience. There is no substitute to experience. There is no substitute. Whatever field you are in, whether you are in community medicine or any other subject, there is no substitute to experience. And there are enough number of examples we can keep on deliberating and talking. And that is why I said we are going to start another project, which is again very near to my heart. That is by the name of Community Medicine Human Library Project. In this, we are going to invite the stalwarts of community medicine, and we'll be talking with them at length. And we would like to gain from their experiences. We'll like to gain from their experiences, and we'll be again streaming it live, or it will be there on the YouTube. And those who cannot watch live, they can later on watch it on YouTube. So you have to share your. It is your moral responsibility. We were born with a clean slate. Whatever we acquired, we acquired here. Whatever knowledge we got the knowledge in this world. Whatever experience we got it from. If we are doctors, we got it from our patients, right? We got it from our friends, we got it from our family. Whatever experiences we have got, you always look for experiences. Whenever you are in a problem, you always look for experiences. What are the experiences of other people? So one must share the experiences. Then one must share the wealth. It's a Chinese proverb. They say the 10% of your annual income must go to charity. 10% of your annual income must go for saving, and 10% of your annual income must go for charity. So you have to share your wealth also. And there are so many philanthropic people. There are enough number of examples where people uh, share their wealth. And in COVID time, it is very important, because there is a lot of suffering in the society. And if you can share few, say, minimal amount of your wealth with people, again that is again will help you. That is again will help you. And then you have to share your workload also. You must understand. And that is what I say. And I like the statement of my secretary general of IIPSM, who always say that if you walk alone, you may walk fast, but if you want to walk for a longer period of time, then you have to walk together, right? So you have to share your workload also. And that is what we did. We are trying to share all the things with all the people, so that you will have to learn. It's not that only one person in the department is doing all the work or taking all the projects and not allowing others to participate in the work. So the workload is to be shared, your knowledge is to be shared, your your experience is to be shared, and your wealth is to be shared. So there is so much to do you in life. You must understand, this is a I told you in the beginning that, you see, the answer of stress lies in stress word only, and this is again a lifestyle which you'll have to follow. And now coming to the last S which is there, that is, if nothing works, then you surrender to Almighty. Whatsoever faith you have got, you surrender to that. Maybe that is a supernatural power. I believe in supernatural power which is there. So we have to surrender to that. Everything in life cannot be controlled. Remember this. Everything in life cannot be controlled. One has to perform the duties and don't get attached to the results. So that is what our Gita also says, that you do the karma. And who does the karma? Also Gita also says that who does the karma? The Krishna Bhagwan says, I am the karta, you are not the karta. You think that you are the karta, but I am the karta, right? So of course there are different philosophies in life, there are different religious belief in life, but then goodness is something which is universal in every philosophy, in every religion. So if you are good to others, then yes, you have to share a lot of things and you have to erase a lot of things in your life. Forget and forgive to live. Remember, the stress is an acronym. Follow the full form of the stress and remain happy. That is what I wanted to talk about. That is what why I understand the meaning of non-pharmacological management of stress. I hope I have given you something which was not known to you. If it was known to you, very good. You are a very knowledgeable person, and then I am thankful for your time which you have given for listening to this talk. Thank you so very much. If there are any questions, and you can ask. Of course, there are a few people on Zoom. If they want to ask or discuss anything, you are welcome. Yes, if there is nothing, then I will stop the screen sharing.